Assalamu alaikum. Good morning, everyone, and thank you for having me and give me this opportunity. I'm waiting just for my slides to appear. So I start by disclosing that I don't have any conflict of interest. This is not to promote any person or company or product. But I will mention some of the national and international institutions and teams that contribute to the success story that we preview here. Next. Okay. So this is related to the mask that I did not remove from the start. So next. Yes. So the first question, do you know this guy with the face mask? I think he's well known, even with mask. I don't know. Okay. So this is the mask effect. This is Mr. Bean. And alhamdulillah that I'm allowed to remove my mask so you know me on this screen. Next. Okay, so I will talk today about the main safety concern in simulation operation. We have a lot. And the simulation safety guidelines and resources, how we get those guidelines in simulation. And I will talk about also the adjustment that we did during the COVID-19 pandemic and crisis. Okay. Actually, the statistics show that the demand in simulation did not go down by numbers. It was actually keep on the same level. Like in Crescent at King 5 Medical City, we have pretty the same numbers of training sessions. We have 250 training sessions and more than 4,000 trainees per 2020 alone. And it is actually matching the previous 5 years, as you can see in the screen. And those statistics on the screens are only for the skill lab. We have also the life support, we have the STARS, the surgical simulation, and we have the nursing lab and the In-Situ training. And I will show you also the operational challenges that we have during the pandemic. Next. Okay. So the simulation operation, for those who don't know, actually, it is the efforts and process of utilizing the available resources to implement the healthcare simulation plans. We are working to achieve the strategic plans of our institutions and also the goals of the simulation center. Next. Okay. The health care simulation, actually, the main definition of the simulation is a safe learning environment, and that it should be always safe environment. As they said, the safety first in everything, especially in the simulation. You don't want to bring people and they may be harmed. So the simulation should be safe environment, like the place, machines, tools, consumables, and a lot of environmental factors. It should be safe to the learners, employees, and everyone involved. And then the physical safety should be also maintained, safety of the people involved, trainees, instructors, staff, and everyone. And the last is psychological safety, and it is very important to keep them safe, especially the trainees, then instructors and staff and others. Thanks. Okay. So actually there was a huge pressure on the simulation operation during the crisis. On one hand, we are required to train people and prepare them to just face the crisis that we have. So we are required to train as much as we can of the staff and as fast as possible. We have a limited time, like 2, 3 to 4 months to be ready. As you can preview, you previewed already with Dr. Amira, there was national efforts and even international to upscale the trainees numbers or the healthcare workers numbers who are able to deal with COVID-19 patients. So we are required to train as much as we can and as fast as we can, and at the same time maintain the quality of the training. And it is really challenging, especially for the simulation centers and simulation teams. On the other hand, there is a risk of safety, the COVID-19 situation, and there is a limited time. And the trainees actually and the trainers are the first liners who are dealing with COVID patients, and we want to bring them all together for the training, and this actually was a risk. On the other hand, also we have limited resources. We don't have that scale of resources to train people on the space. Of course, the PPEs was very limited at that time. We utilized them for the patients. And we have limited simulators, staff, consumables, even PCR tests to confirm that the trainees are healthy. So those are the balance that control our efforts or plans to upscale the training and increase the operation. So we are required at that time of planning to do this target of do 4 courses and train more than 4,000 people within this short time of 4 months from March to June. So we do 5C course and the COVID-19 critical care course for nurses and the physician course, and we have our own courses for KFMC, King Fahd Medical City, to do the airway management in the In-Situ training for the ICU, ER, OR, and other multiple sites. So the target was really very huge and challenging to achieve it within in a very short time, and it is really the #1 challenge was the safety. So what we did actually to achieve that in a safe learning environment, we go back to the references first. So we go to Ministry of Health, Wiqaya, World Health Organization, those other resources to know what exactly we should do to keep people safe and maintain safety in the training and simulation. And then we develop our own guidelines that match our resources and rooms, spaces, and So in order to make everything clear for our staff, so we developed the practical guide for infection prevention in the simulation center and life support. And then we plan what to do with the infrastructure and resources that we have. At the same time, we adjust the staff level, the simulation staff level of knowledge and skills in dealing with such challenge. And then, of course, infection prevention guidelines to just publish them and announce them for everyone involved, for the staff, the trainees, instructors, and everyone coming. And we should maintain them in the pre and during and after. Then we start by set those clear instructions and protocols and announce them for everyone who is coming to the simulation or the training. And we make a mandatory step to convert all theories and lectures to online and pre-recorded sessions. So, and that was actually a huge step forward to just focus on the hands-on skills. Then we activate the online links and forms, barcodes, and we limit the door access and crowd flow. So we go to the floor plans and we redesign them and structure them where the trainees will come and where they have to go and from which place they have to go. And we develop the declaration form, which is a checklist, and we activate the tracking of all involved people in the simulation, the participants, instructors, and everyone. We track them all and we get their data so we can communicate with them and keep them informed all the way. Next. So this is one example of the mandatory actions that we take during the the sessions, before the sessions, and in the registration desk. We mandate the protective mask to be on all the time for everyone, and more often of alcohol hand washing for everyone. Less number of trainees. We watch the social distancing, and everyone actually required to wear the surgical gloves or latex gloves during the practice on the simulators, and they have to change them every time. So they are not allowed to touch the simulators or tools without gloves. And then we do a lot of service cleaning, mannequins cleaning, instrument cleaning between each group. So if we have like 4 groups, between each group we go in and clean those tools and mannequins to make them safe for the next group. So we minimize the cross infection transfer if it is possible. So, and this is actually support what Dr. Saeed Jamil said about the visual guidance of the people. So we did actually put a visual marks on the ground and even on the walls. We give them signage to what to do, how to do, and where, and with the efforts also of the checklist that we develop to check their health status and declaration so we can track them all safe are to go in the training. So we did this before we bring them to the training. And as you can see in the waiting areas and also in the training rooms, we put marks where they should go. And actually we assign staff from the simulation center to watch those process and orders to be followed. And then, so strict distancing. And as you can see, we did actually pre-recording materials, and we support and we provide it to the trainees before they come. So even for some of the practical stations, we record the video and we show them those skills, what they should do. And actually this helps in two things: to minimize the stay in the center. It will minimize the time that they have to spend in the center, and also minimize the number of trainees in the same room. As you can see down the screen there, we developed the method, or we utilize the method of record the presentations, so they can, the instructors can record their sessions and put it online. And then this is an example of the declaration form that we use, and this is an attendance sheet, and it was mandated for everyone, even the staff of the centers. They have to go to this form every day and declare their status and put their communication or contact numbers and informations, and we make sure that everyone is informed. Even the cleaners of the center, they were required to do this form every day. On the other hand, as we said, the space was limited, and to reach this target, huge target of trainees, it was really challenging. So we have to look to other solutions to achieve this goal. So we minimize the skills lab training, as we said. If we, in the regular days, accommodate like 6 people in this room, now we accommodate 3. So still we could not achieve our goal. So what we did, next. So what we did, actually, we increased the in-situ training inside the hospitals, inside the departments. So we ship our mannequins, tools, and everything to the emergency room, and we did pediatric and adult. We ship it to the operation rooms, and there was a multi-sites actually running at the same time. Also in the ICU, the pediatric ICU, and other departments as well. And at that time we had limited resources, like we don't have hemodynamic, more than 2 or 3 hemodynamic simulations. So we look to the market and how we can find virtual hemodynamic monitor. As you can see here in the left, one of the virtual hemodynamic monitors that can be controlled by the instructor. And also we re-innovate our obsolete models. So we bring them back to life. This is, on the right, actually was one of the mannequins that actually it was dead. It was on the DNR room. So we return it back from the simulation stores, and we utilize them in the in-situ training along with those monitors on the left. So that enabled us to maximize our resources to do another training in other place or area. Next. As you can see, those are the borrowing data in 2020. Actually, we did 164 actions of borrowing, and that was involved 262 items to be lended outside the center, so they can train in their own departments, especially the nursing department. They use those items a lot, and they can go for one-to-one training, 1-to-2 training, one instructor, one trainee, or 2 trainees to do COVID-19 related training. So that was a very helpful action that done by the Simulation Center and the administration. Next. So what we achieved actually at the end of this operation, we trained 550 people in this skill lab, in the simulation center. But the majority of people was in the In-Situ, in the clinical area. So we trained, we reached our target actually, and we trained 3,700 people in the bedside. And those are the data of 2021 so far until the end of this November. In the whole Crescent areas, we train about 7,000 people with more than 900 training sessions. So those are really a huge number. And actually what was the result of those, following those guidelines and the efforts of the teams inside King Fahd Medical City and the administration. So we achieved, alhamdulillah, until today, 0 infection case reported as a result of training at Crescent. So we achieved, alhamdulillah, no case was reported, even with those huge numbers of trainees and instructors. There is no case reported at Crescent. Next. Next. Okay, so this is a picture of the team who was behind the, this huge effort and achievement of the simulation operation. And we did also our best to really achieve those results, but at the same time with safety, keeping safety for everyone. So thank you for the Crescent team. Next. And now the take-home message actually is the same as the Ministry of Health and the government is cautiously we return, and we have to keep committed to the guidelines, and we did and we achieved. So yes, we are going back to the other training sessions and simulations, but also we have to keep the safety first and follow the guidelines by the administration and other resources in this field. And this is the end of my presentation. Thank you for listening, and I'm ready for any question. Thank you.